If you've ever felt like you're doing the most work in a system while earning the least leverage, stay with me. This conversation changes how you see your future. 10 healthcare businesses nurses can start that have the power to replace your clinical income, scale beyond six figures, and position you as the owner instead of the employee in this $1 trillion business.
Hello, fellow nurse entrepreneurs. One of the things that I've always wanted to do was always wanted to help nurses work from anywhere, pretty much have the flexibility, pretty much have their freedom so that they could do whatever they wanted to do.
Joining VP Nursing was one of the best decisions that I could have ever made. If I was to have a regret, it would be that I didn't join sooner.
If they wanted to be with their children, if they wanted to be with their families, they can do exactly what they wanted to do.
Ola is the type of person, she's not going to let you stay the same. The way she levels up her clients in every area of their lives.
I could not have imagined being a nurse with my own business, being in this space with so many amazing people, with a coach that 1,000,000% cares about what my outcome is going to be.
And so here at VP Nursing, we teach nurses how to work from their computers anywhere around the world, making money, owning their own time, building profitable nurse coaching, consulting, and service-based businesses. And so now we're at the beach and we're working at the beach and we're having a great time. We're doing a brand photo shoot. It's an amazing time. So if you want to learn how to work from anywhere around the world, creating that flexibility, creating that freedom for yourself, but monetizing the knowledge that you already have, join us at VP Nursing Business Academy.
Hello, everyone. So welcome to our live. So one of the things that I wanted to talk about is that, this is the real problem that nurses are facing, right? So they are facing being highly educated, but then, the income does not match that high education, right? The clinical roles, we trade time for dollars. And then burnout is on the rise. It's always been on the rise. It's been on the rise for a long time, to be honest, right? It's been a significant staple in healthcare. And I remember, being burnt out myself. I remember thinking, how in the world can I continue this and still say sustainable, right? But then the issue is not really skill. It's because you don't own the business, right? And so this is the deal. Healthcare is a multi-trillion-dollar business, right? Nurses already understand the systems, the outcomes, and the risk. But business ownership allows your income to scale without more hours. That's the difference, because you put systems in place to help you scale your own business. And then you're not capped. Your income is not capped to that 2 to 3% that they give you every year, right? So they only give you really between 0 and 3%. And then that 3% only, you have you have inflation right now, it's at 3.5%. So you're not really making any headway. And really, they really want you, they don't really want to give you, someone was on my masterclass the other day, and they were talking about the fact that they don't really want you to give the 3%. They really want you to give the 1 to 2, and then tell you have room for improvement, right? So the gap is business strategy. And that's one of the reasons why I've been so passionate about teaching nurses about business, because when I first started, one of the things I wanted to do was to help nurses. I just didn't understand what I wanted to do. And so I started doing relationship coaching. I started doing financial coaching. I started doing life coaching. But what I found was that nurses needed a way to maximize their income. And that's when I started doing the business coaching. Now, I just wanted you to know that we're having the Millionaire Nurse CEO conference that's coming up. And the reason why this matters is because it's not about motivation, it's about execution. And so you have to be in the room where nurses learn to position that expertise as revenue, right? Because real business models are that's what we're going to be talking about, and not side hustles, right? This room is filled with nurses building real companies now. Right. And so you want to be in that room because you want to be able to understand. Now, this is the reason why healthcare businesses are exploding right now. The aging population plus chronic disease growth. So when I first started, there were times when I actually had time to rest during the shift. Like there were times we actually didn't have anyone in the emergency department. Those days are typically gone. And especially during the time of the winter months where you have all the, COVID is coming back, the flu is there, all those things that come and they drop up. revenue for the hospital during that time, but they also drive up the actual intake of the patients. And so with that being said, you have to be in position yourself in a way that you can really, really help, right? Now, workforce shortages, right? So that's driving outsourcing, which means that the less nurses that they have at the bedside, and nurses are not leaving the bedside because there is a lack of nursing. Just be clear about that. Nurses are leaving because of the burnout. They're choosing to do something different. So if you want to choose to do something different, then you have to be in that space. Now, there is this thing. So I don't know if you are aware, but previously when you were in healthcare, one of the things that they used to do is like every time you would have a CT scan or every time you would have an x-ray, they paid you based off of, it's called fee for service. But a while back, that fee for service was replaced by value-based care. So basically they reward the hospitals for prevention and outcomes. Now, does that translate to some hospitals? No, right? And so you want to make sure that that value-based care is being given. Now, the total addressable market this is a $4 trillion annually market, okay? Home-based care, consulting, wellness, and specialty services are the fastest growing segments. Nurses are trusted, licensed, and already inside the system. So you can definitely grow your business from that, right? Now we're going to talk about the 10 businesses that you can really grow to, not just replace your income, but really to double, triple, quadruple your income, definitely for that. But you want to be in a room with other people who are in this market of taking this business to the next level, because business clarity collapses confusion. And when you're no longer confused, then you can move to the next level. Speed comes from proximity to people who are executing. This conference compresses years into days, and the cost of waiting is higher than the cost of acting. So I want you to hear that. And then we're going to talk about the 10 business models. So there is home healthcare agencies. Now, total addressable market. This is what when I mean total addressable market, how much money can you make in this market, right? Or how many people can you touch in this market? It's $225 billion and growing. The annual earning potential is $2 million to $20 million, okay? This revenue comes from systems, not shifts. So basically you set up your system, you hire your staff, right? I had a client that came to me and she actually she had a business, but she was really the only one who was the leader in the business. And we helped her build her leadership infrastructure. And as we helped her build her leadership infrastructure, she was able to scale her business to 7 figures. The reality is that this really is one of the biggest booms in healthcare right now is the home care agency. And see, what nurses are doing is you're leveraging staff, not personal labor. And so you want to make, there is a demand given by aging population and early hospital discharge. So value-based care, basically what they're doing is they're not like, we have meetings all the time. We used to have meetings all the time, just so y'all know, okay? Because I want you to understand the value of this. We used to have meetings all the time about how many days this person was going to be in the hospital. And the reason why is because if you can shorten the days that the person is in the hospital, then you can get somebody else in that bed, because you're paid by, I think it's called a DRG, right? And that DRG only gives you but so much money for that particular disease process of that particular patient. Well, once that money runs out, that patient's supposed to be in the hospital for 3 days, and they're supposed to have a certain amount of money that is given to them, and then you exceed those days, and now you're losing money, right? And so the hospitals don't want to do that. So basically they want to get the patient out of the hospital as soon as possible, treat the symptoms, treat them for where they are, and then get them to where they need to be. Now, the reason why this model wins now is because hospitals need beds freed faster, okay? Now, payers prefer low-cost home care as opposed to being in the hospital, right? Nurses already understand compliance and care coordination, and so they're able to do this. And we show you the structure. And so within our program, one of the things, especially at the conference, we show you the structure of, home health care and why is it so important right now. So the exact steps. So we have a home healthcare pathway that helps you to understand how to make real money doing this, doing home healthcare. Now, the next one is kind of a niche type of business. This is business number 2, is the pediatric home healthcare agency, right? And so this is the realization of this is that the total addressable market is $50 billion plus, right? The reason why they have higher margins is because you have the specialization. Like you have these kids that are being born with these special needs, and when the kids are born with the special needs, then the family needs help taking care of these kids, and especially within this environment in which we have now, where there is this. Even if you find out that this is no judgment, it is what it is. But even if you find out that the kid has a special need, like sometimes they find out while the kid is in utero, well, what happens is they're no longer at a point in time in their pregnancy able to terminate the pregnancy. Well, if they're not able to terminate the pregnancy, then what happens is then, they have to deal with these lifelong issues when it comes to, raising a child with special needs, right? And they are precious. Okay. I absolutely love them. And one of the things, because I used to work for a pediatric home healthcare agency, and one of the things that you can do is start a pediatric home healthcare agency and run that thing, amazing. And what happens is you have the ability to be able to help these families, but not just that. You have the ability to be able to help your own pockets as well. So the reason why pediatric care is a power move is because you have fewer competitors, it's high demand for skilled nursing, and families need this continuity, right? Not rotating staff. They don't want a bunch of people coming in and out of their homes, right, while they're taking care of the staff. So the conference connection is that you have, we teach specialization strategies, right? Because we want you to niche down, because the more niche you are, the better. That is what that is, right? You want to make sure that you're niche to the population in which you care for. And so one of the things that the client that we helped to get to 7 figures, she was niching down to children with disabilities that had aged out of the pediatric population, right? And so there was a whole market that was not being addressed, and you can do that as well, right, in your own area. And so we want to make sure that we're teaching you the power of specialization. Now, the next, number 3 business is health and wellness coaching and consulting. Now, everybody wants to be skinny. Everybody wants to look good. Everybody wants to have, that perfect figure, right? And it's not just about how they feel, but it's also about how they look. And so that's the reason why the total addressable market here is $5.6 trillion globally, right? So corporate wellness alone exceeds 90 billion. And so corporate wellness, like if you go into a company, the company don't want you to be out of work, right? And the less well you are, the more that you'll be out of work. So the annual earnings potential is between $500K, $500,000 to $10 million plus, right? And you don't have to depend on insurance, right? You can be out of pocket paying for this. Your clients can be. And then there's high margins and low overhead. Now, you can do group programs that can place you one-to-one time. And then you can do retainers, right? You can have a community where you can have predictable income. And then, of course, the frameworks that places you outside of the regular market, right? You want to have a framework that's very unique to you. And so one of the things that we want to do at the conference is we want to help you to package the expertise that you have into offers, right? Because messaging we want to help you to create the messaging that sells, not ours. This is where nurses stop undercharging, because nurses do that a lot. And we want to stop you from doing that, because at the end of the day, it is something that people want, but you want to make sure that you're not undercharging, because you're the clinical expert. You're amazing at what you do. You've been nursing for a long time. The nurses that we teach the leaders and the experts, right? Now, the next is assisted living homes. This is huge, 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 especially right now, right? Because what it does is it brings together these, regardless of, we'll just say that if it were the 65 old and older population, right? So even if it was that population, right? The 65 and older, you're bringing them together in a home space where they're not necessarily in a nursing home, right? And they're able to have, other people that they're hanging out with that they really like, and they can, have that community. It's such a sweet thing, and it's small, right? So it doesn't, you don't, of course you can have several. That's the goal, right? You want to have a bunch of, assisted living homes, but instead of having, like, it feels like, when you go into long-term care, right? You have these big areas where you have all these, all these patients. You can have, it very small. So the total addressable market for this assisted living homes is 120 billion. And so one of the things that we have done, because we have been real estate investors, we help you with the real estate investment path of that, right? And understanding how to get the home, how to, ensure that the home is, and also, affordable ways in which you can go and get furniture for the home and things of that nature. So the revenue that you can make is $3 million to $15 million annually, right? So this asset backed income plus it appreciates over time, right? Monthly recurring payments, right? So you have predictable income coming into your home, right? And then you also you learn about home real estate. And so this is the thing. A lot of people ask about McDonald's, and then they say, well, McDonald's is in the burger business, but McDonald's really isn't in the burger business. They're in the real estate business, because each of their places where whoever buys their franchise, they buy the land where the McDonald's is owned, and the owner who buys the franchise for that time, they rent from the McDonald's the big corporation, right? So they're not in the business of burgers. They're in the business of real estate. And so how about you have a real estate portfolio in addition to having this? It can blow up and really, really help you make a lot of money, because even if you don't have the home there, then you can sell the home, or you can just rent out the home, right? So you still have earning potential regardless of whether you have an assisted living there or not. So your systems generate income even when you're not present. So, and then of course the exit opportunities through acquisition. Like you can help other people. You can help them with their homes, right? Have affordable homes, if that per se, right? So we talk ownership, right, at the conference. The Millionaire CEO conference that's coming up, not just operations, because you want to think like investors. This is where leverage building, legacy buildings business comes from. Okay. Now, healthcare compliance consulting, huge, right? The total addressable market is $60 billion. So the annual earning potential is $500K to $5 million. So, which is $500,000 to $5 million. Hospitals pay to avoid fines and shutdowns. So in the hospital, and regardless of whether it's a hospital, it's a long-term care facility, wherever it is, everybody is regulated in order to ensure that they're providing the best care, right? So in the hospital, just because I used to work in that system, we had what's called RFIs, right? Which is room for improvement. So if JCO, which is a governing agency, or the state comes in, they'll give you an RFI. You're typically going to get a few, right? And when you get that, you want to leverage that. You don't want to always have RFIs, because they cost you. You're fined for that, right? So they'll pay you so that they don't have those RFI and have to put in the extra work. So we've got a client that came to us, and she did this for dialysis agencies, right? And so with the dialysis agency, one of the things that she did for this agency is that she helped them with their compliance. So she decreased their RFIs so that they were able to collect more money, they were able to keep more money, right? And so they said that they would keep her. And so she landed her first six-figure contract within 6 weeks being in the program, right? Because you already understand regulations. And especially if you've ever been a manager, you understand regulations like the back of your hand. And so you want to make sure that you're helping other people do the thing. And then you can help them with risk reduction, right? And then your expertise commands authoritative pricing because you already know how to decrease those RFIs. So at the conference, nurses learn how to sell expertise confidently, right? And this is where your credentials become your currency, right? So nurse practitioner practices. So if you're a nurse practitioner, some people choose to go to work for other people. I have a friend who's a nurse practitioner, and one of the things that she said was that, I see all the money that's coming into this business and I want to start my own practice, because you understand that, right? And I don't know if her boss is a nurse practitioner, but you don't even have to be a nurse practitioner in order to own a nurse practitioner practice. You just have to understand how the business works. And that's one of the things that people just really don't understand sometimes. Total addressable market is $150 billion. All right. Annual earning potential. And you need nurse practitioner practices, because what's happening is the physician, there's a lot of physicians who are struggling, right, to keep up with the patient population. And so when you have your own nurse practitioner practice, you can help them keep up with the patient population. And then there's some states within the United States, those states have full practice authority. So you don't even have to have a physician collaborator in order to own these businesses, right? You own the billing and the service lines. So you're able to collect that money up front. That's your money, right? And you're able to hire and scale providers. Now, the reason why it's expanding fast is because of the provider shortages, right? Consumer demands for access. You have people that are sick, or you have people who need to move into business. And you want to make sure that you're doing that. Now, we teach business ownership again at the conference, because we want to make sure that you're building practices that scale. So this is how NPs stop being overworked and become owners. Now, mental health advisories. So this is huge too. This is a $60 billion business. High impact, outcomes driven services. So buyers include hospitals and organizations. So mental health is a huge problem in the United States, or wherever you are, right? It's a huge problem. And it's more, it used to be taboo back in my day, but it's more acceptable these days. And so you want to make sure that you are helping them with mental health, especially if you're the mental health person. Now, I'm not really that person, but it really helps you to address that market, and they're making bank, right? Because maternal mortality, because of the mental health crises that are going on in the world, you want to make sure that you are helping them. And there is federal and institutional focus on mental health, right? So nurses are already credentialed in this space. You would also, the next business is maternal health, right? Maternal health, when it comes to people who are like, they have their first businesses, they are able, not first businesses, but first babies, you're able to help them with their babies, right? And they'll pay, premium dollar in order for you to ensure that their babies are born, to advise them on their babies being born healthy. That's really huge. Now I'm gonna stop right here, and then we're gonna go to commercial break so that we can talk about the conference. Okay, hold on.
Stop renewing your license just to stay broke. Every renewal season, nurses pay fees, take classes, and check boxes, but never build wealth. That license you're renewing every 2 years, it's a gold mine if you stop using it the old way. At the Millionaire Nurse CEO Conference, you'll learn how to leverage that same license to build your own business, to coach, to consult, and to create offers that bring freedom, not fatigue. And yes, you'll still earn CEUs. Comment conference below and we'll send you the details.
All right. So we're back. So the next one is hospitals readmission consulting. So this is one of the things that I was an expert in. This is how I transitioned from being a readmissions consultant within the hospital, really not a consultant. I worked for the hospital doing the readmissions. I was a readmissions manager. So some of you don't know, but whenever a hospital readmits a person within 30 days, what happens is that person, the hospital incurs a fee, and sometimes insurance won't pay. And so they want to make sure that those patients are staying out. So one of the things that I did, I was able to help my hospital go from 12% to a 9% readmission rate. And so it's huge, huge, huge for you to do that, because you are saving that hospital lots and lots of money. Because one admission, I mean, that can be, it depends on what the admission is. I mean, it can range from, $80,000 to $120,000 per admission, right? So hospitals lose $40 billion annually to readmissions. So consultants can earn anywhere from $1 million to $10 million annually, right? Paid on cost savings and outcomes. So you want to make sure that you have the outcomes. And so we teach you a little bit about that, because we teach you how to build programs that help the hospital save them. Penalties hurt the bottom line, right? And so prevention is cheaper than penalties, and nurses understand transitions of care. So we teach at the conference, we're teaching you a lot about enterprise level positioning, so that you can speak the executive language, so that you're able to get in there. So the next one is one that's near and dear to my heart, is ER consulting, right? This is the deal. The total addressable market for this thing is like $30 billion, right? It focuses on throughput, staffing, and efficiency, because as well as I do, that the more, the national rate for left without being seen. So the worst place that your patient can be is to leave without being seen. That's the most dangerous place, okay? Because the patient can come in. I can tell you stories after stories after stories of patients that came in with chest pain. And when they came in with chest pain, they left and went home and had heart attacks and died, right? So you don't want your patients to leave. You want to make sure that they are there. But in order for you to make sure that those patients are taken care of, then you have to make sure that the throughput of that patient, the patients that are in the back, that those patients are getting through, right? And so that's huge, 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 right? And so all of that efficiency, you want to make sure that your staffing is efficient, right? So this is the deal, is that overstaffing or overcrowding in ERs is a huge problem these days. That's one of the reasons why I left the ER, because I just couldn't deal with that. And that's one of the reasons why I went into management, is because I felt like I could make a difference there. But, you have to ensure that is the right space to make the difference, right? So nurses learn how, if you come to the conference, we teach you how to monetize these lived experiences. This is where the ER nurses become strategists. No more shift-based ceilings, right? You're able to build your own business. Now, this last and bonus one is great. So this is the nurse wellness retreat business. So this is $180 billion business globally. Okay. The annual earning potential is $500K to $10 million. Premium pricing, group leverage. So this is the deal, is that nurses are burned out. So if you start a nurse wellness business to help them, I mean, like, that is totally cool. I hadn't even thought about that when I first started doing the research, but this is one of the things that you would definitely want to do. Burnout is at an all-time high. So nurses are seeking restoration, and employees are funding wellness. So you want to make sure that you're doing that. And even if the employees are not funding the wellness, the nurses are. So we teach you how to run a brand. We teach you how to leverage your brand. We teach you how to have eyes on your brand, visibility, because that's huge. And so all these businesses are businesses that can help you grow. And the total addressable market is incredibly large. So we encourage you. We want to see you at the next Millionaire Nurse CEO conference. It's going to be amazing. We can't wait to see you there. You ladies and gentlemen, have an amazing rest of your day. Bye-bye.